Interesting that on a day when we are celebrating, or we should be celebrating, the freedom of enslaved people from the chains of their enslavement. Did I say enslaved? I meant enslaved. What the hell is wrong with me today? I don't know. I got up too late, I guess. Let me start over. On a day when we are celebrating the freedom of enslaved people from their enslavement, it's interesting to note that more than 1 million American citizens, including, one can easily guess, lots and lots of our black brothers and sisters, they have been dropped from Medicaid because states are beginning the post-pandemic purge of the Medicaid rolls of people who had to have Medicaid in order to just goddamn stay alive. Well, no more, boys and girls. Some states are moving very quickly to halt health care coverage following the end of the coronavirus pandemic, even though we are still losing, 200 people a day? Is that the number? 100, 200 people a day are dying of COVID-19? Oh, but the pandemic's over. Don't worry about it. A lot of these 1 million people, according to Associated Press, have been dropped for not filling out paperwork. Not filling out paperwork, which I think it's safe to assume was sent to these Medicaid recipients via email. And if they didn't have email, well then, gosh darn it, they probably didn't get the necessary forms to fill out. Now, this eligibility review is required by the federal government. You know, the forms. And according to Associated Press, Biden's administration just isn't too damn pleased at how efficiently some states are accomplishing the task. You can imagine what the states are, right? Let's get these Negroes off the rolls here. Fuck them. Daniel Sy, who's the top federal Medicaid official, recently told reporters, quote, pushing through things and rushing it will lead to eligible people, kids and families, losing coverage either permanently or for some period of time, end quote. Now, already 1.5 million people, I'm talking about 1 million that this is going to happen to within this week. About 1.5 million people already have been removed from Medicaid in more than 24 states. This process, I remember talking about it, started back in April and May. According to publicly available reports and data obtained by the Associated Press, that's how many have been dropped already. Ron DeSantis' little DeSantistan, south of the Georgia border, has dropped several 100,000 people, by far the most among the states. Why, of course. The drop rate has also been particularly high in other states. And then the AP reports this. For people whose cases were decided in May, around half or more got dropped in Arkansas, Idaho, Kansas, Nevada, New Hampshire, Oklahoma, South Dakota, Utah, and West Virginia. And by its own count, the state now run by this psycho bitch, Arkansas, has dropped more than 150,000 people from Medicaid. Well, what do you say to this, right? Now, the eligibility, let me just share one of the personal stories here that AP came up with. The eligibility redeterminations, that's what they're called, have created headaches for people. Here's one. Jennifer Mojica, who's 28 years old. She was told in April that she no longer qualified for Medicaid because Arkansas had incorrectly determined her income was above the limit. The key word being incorrectly. So through diligence and God knows what, she got that resolved. But then she was told her 5-year-old son was being dropped from Medicaid because she had requested that he be dropped. Oh, that makes sense, doesn't it? That's something that never happened, she said. Well, her son's coverage was restored after God knows how much effort and frustration on the part of mom. But now Jennifer says she's been told her husband no longer qualifies. Can you fucking believe this? I mean, this is just one family. First, then the child, then the dad, each in their turn being told, hey, you're out of here. Miss Mojica said, quote, it was like fixing one thing and then another problem came up and then they fixed that and then something else came up. Now, officials in Arkansas, where the governor there is the psycho Christian nutcase, Sarah Huckabee. Arkansas officials said they have tried to renew coverage automatically for as many people as possible, of course, and placed a special emphasis, of course, on reaching families with children, of course. But, there's always a but, right? A state law passed in the state of Arkansas in 2021 requires the post-pandemic eligibility redeterminations to be completed in 6 months. And the state of Arkansas will continue, quote, to swiftly disenroll individuals who are no longer eligible, end quote. That's according to the Department of Human Services in the state of Arkansas in a statement that they issued. If you don't get this done by the time we tell you, you're fucked. Why is this happening at all? Anybody who is on Medicaid, as far as I'm concerned, for a pretty goddamn good reason. Because they can't afford regular insurance, health insurance, or for a number of reasons. But the crazy bitch Sarah, who runs the state of Arkansas, said last week on a Twitter feed, or last month, quote, those who do not qualify for Medicaid are taking resources from those who need them. But the pandemic is over, and we are leading the way back to normalcy. Normalcy? Normalcy being when your 5-year-old child has his or her Medicaid taken. Normalcy when your Medicaid is taken. Normalcy when your spouse's Medicaid is taken. That's normalcy in the addled Christian fascist brain of Sarah Huckabee, the governor of Arkansas. Oh, this shit just doesn't stop, does it? No. More than 93 million people, according to the Associated Press, 93 million people nationwide were enrolled in Medicaid as of the most recent available data, which was in February. 93 million. That's a fourth of the population of this country. A little bit more than a fourth. And that's up nearly 30 million from the pre-pandemic total in January 2020. And the Medicaid rolls swelled because federal law prohibited states from removing people from Medicaid during the health emergency in exchange for providing states with increased funding. And try to remember, because I can't, how many states refused the extra Medicaid money when the pandemic hit. Just remember how many states, or try to remember how many states refused the federal money, Medicaid money, to cover their own citizens. Because, well, it's a communist thing, But now that eligibility reviews have resumed, are you eligible for health care? What a fucking question to ask somebody. Hey, are you eligible for health care? Huh? And what's it dependent on? Well, a number of factors. The federal government has come up with very elaborate schedules and graphs and all kinds of shit to determine whether or not you're eligible, as you stand there waiting for some medical catastrophe or healthcare catastrophe to hit you. And then what do? Well, fuck, you lose everything. That's what you do. Anyway, now that these eligibility reviews have resumed, states have begun plowing through a backlog of cases to determine Whether people's income or, I love this, life circumstances have changed. And the states have a year to complete this whole process. Now, as far as the states are concerned, tracking down, responses from everyone necessary has proved difficult because some people have, moved or changed their contact information. Maybe they don't have a phone service anymore, or the computer is no good anymore, or they disregard mailings about the renewal process. You know how people can be, right? Huh? Before dropping people from Medicaid, the Florida Department of Children and Families, it's a very charitable sounding name, isn't it? But that department said it makes between 5 and 13 contact attempts, including text, emails, and phone calls. Yet the Florida Department of Children and Families said 152,000 people have been non-responsive. Ooh, you like that word, non-responsive? So many times that means you're dead, but Idaho. Unlike some states, Idaho continued to evaluate people's Medicaid eligibility during the pandemic, even though it didn't remove anyone from Medicaid. And when the enrollment freeze ended in April, Idaho started processing those cases, and Idaho dropped nearly 67,000 of the 92,000 people whose cases have been decided so far. Now, there may be all sorts of rules and regulations, like I said, graphs, all sorts of stuff, hoops that people have to jump through in order to get health care because they're too poor or have other circumstances that prohibit them affording regular medical insurance, which, as you know, gentle listener, can be expensive as hell. So they have all these things that the bureaucracies have required. This is the United States of America. This is the land of the free and the home of the brave. Why do we not provide health care to everyone as a matter of birthright? Huh? Well, I mean, wouldn't that be a good idea? When you're born, I know when my daughter was born, because the law had changed, but when my daughter was born, she was immediately given a Social Security number. Okay. When she was 2 days old, she had a Social Security number. Okay. Then why not give everybody a medical care number at the same time? Or, hell, it could be your Social Security number. And that number would simply mean that for all of your life, if you're an American citizen, all of your life, you have medical care guaranteed to you. Yeah? Our friends in Canada have that. Our friends in other civilized countries have that. But we don't. Ever stop to wonder why? Of course you have, and so have I. And we know why. We know why. Well, if the revolution does occur, and I'm not talking about the Nazi revolution, I'm talking about the revolution of people who have decided that there's a better way to do things in this country, maybe one of the things that will be addressed will be health care for everyone who needs it, you think? Hi, Truth Seekers. Mike Malloy here. You know, the Progressive Voices Network brings you commercial-free commentary from today's leading progressive radio hosts and pundits, like me, Mike Malloy, 24 hours a day. I'm not your typical old guy from the 80s or the 90s talk radio host, and Progressive Voices is not your typical talk radio network. It's a listener-supported nonprofit with no corporate control whatsoever over our broadcast. So hosts like me, Mike Malloy, are free to rant and scream and carry on about whatever we like. We're often controversial, but we're never boring. Weeknights, 9 p.m. in the East, 6 p.m. in the West on the Progressive Voices Network. Always progressive, always on. I'm Mike Malloy. Keep it lit.